Ms. Caroline Van Den Hill. She's an adult psychiatrist and a family and systematic psychotherapist. In 1995, she started to study neurosciences at Brandeis University. She has been working at the Brussels Night Hospital, specialized in the psychosocial rehabilitation of patients suffering from chronic psychotic disorder. She shares the vision and the human being should be regarded in all their dimensions: biological, psychological, spiritual, and ecological. She has been studying and practicing Buddhist meditation.
Hello, thank you for inviting me for this event. So today I'm going to talk a little bit about meditation and mental illness. Why the subject of mental illness? Well, according to the WHO, mental health is becoming an increasing problem worldwide. Especially since the COVID pandemic, we see mental health distress increasing. We know that in industrialized countries, 1 out of 4 people will experience lifetime prevalence of mental illness, and these numbers are increasing. In younger people, we see those numbers going up even more. It is even said that in the US population, half of the people will experience mental health issues, which is a very high number. Depression is the leading cause of mental health problems. Of course, there are other problems too. And suicide is the 4th leading cause of death among 15 to 29-year-olds worldwide. And 2nd leading cause in Europe and the US. Severe mental illness, people with severe mental illness, so that includes people with really serious mental health issues, they also die prematurely 2 decades earlier than the average of the age cohort. 20 years earlier. So that's really a very high number. It's because of suicide, of course, but also because of other comorbid pathologies. Then we see actually that the numbers are really increasing and are really alarming. On the other hand, in most countries, access to effective treatment still remains very low. Why is that? Stigma is still very high everywhere. We cannot say that certain countries don't have stigma for mental illness. There is low or no government health funds for mental health compared to other health issues in most of the countries. And people from low to middle income groups have difficult access to effective treatments. It's too expensive for them. So this is where we stand at. So what can we do to solve all those problems? And that's where, of course, mindfulness, most of you already heard of that, was developed in the 1990s by John Kabat-Zinn. He developed mindfulness-based cognitive therapy, MBCT, inspired from Zen Buddhism, which he was practicing himself. He saw the positive effects on stress and wanted to apply those methods on his patients, which were suffering from stress-related issues. And so, of course, he took out the religious vocabulary, and the goal of mindfulness became not to enlighten people, but to help them increase their mental well-being. And this has been very successful. Meanwhile, there has been many articles published showing the evidence of mindfulness for problems related to stress and depression. So why would that be that mindfulness is so efficient? It is even said that, for example, for depression, it's as useful as taking antidepressive medication, but you don't have the side effects of antidepressive medication. And mindfulness has been developed in the CBT, so in cognitive behavioral therapy. Previous cognitive behavioral therapy was focused on symptom reduction. So it was based on this idea of learning theory. The idea of cognitive behavioral therapy is we want to change behavior, And by how to do that? Well, we try to change the cognitions so that the behavior will change too. So one of the most famous cognitive behavior therapy interventions is called exposure. For example, let's say someone has a spider phobia or an elevator phobia. Well, we expose that person to spiders or elevators as much as possible, and so in the end they will get used to have a spider in the hand, for example, and at one point learn that the spider is not that dangerous, and be less afraid of the spider. Well, the problem with that, well, it's a very efficient approach, but the problem with that is that many people with phobias are just too afraid for exposure, and so they won't dare to do it. So exposure, you need a lot of courage to do it, and sometimes people are just not ready for that. And it also other cognitive behavioral therapies interventions were too much focused on changing behavior. Another approach, which is very famous, has been used for well, now more than a century. For more than a century, is psychoanalytic approaches. So the psychoanalytic approach will be different than CBT. The idea here is to find the origin of the trauma behind the phobia, for example, or behind the stress or the depression, and the person will take a psychoanalytic therapy, which might last for many months, years, to help to understand the origin of the trauma in the childhood. But we see in reality that it's very interesting and very nice. I'm not saying that it's not working, but for many people, when they even can really identify the trauma in a rational way, they can see where it comes from. It will not help remove their anxiety and remove their symptoms. They are still struggling. And that is because we as human beings, we are emotional beings before we are being rational beings. And we need to work on those emotions. And this is where mindfulness comes. And mindfulness is an approach that is non-judgmental. So the person looks at his or her emotions, looks at them in a non-judgmental way, and accepts the emotions, whatever they are, that come into that they feel here and now. So they are also learning to really be aware of what's going on right now in their bodies, in their minds, because as we all know, many emotions express themselves as bodily sensations, and so feeling those sensations, giving the time to look at them instead of running away from them, really helps to learn to identify them and really also understand, okay, when I feel my heart beat faster, that means that I'm more stressed, and things like that. And so in our society, we are actually learning to flee from negative and uncomfortable emotions, and mindfulness meditation does the opposite. Actually, it says, okay, instead of running away from them, let's look at them just as they are and not judge them, and let's look at our emotions in a compassionate way. And we also don't need to react immediately on them. So what we see is people with mental illness, many of them, they have emotions and they react immediately to them. They feel bad and they do something to stop feeling bad. For example, they'll start eating because they feel stressed. They start eating, and so they eat, and then they have it can give eating disorders, or they can go and buy stuff to feel better. So we have been taught a lot to be very reactive to things and very impulsive. And thanks to meditation and mindfulness, we unlearn those reactions of reacting immediately to uncomfortable emotions that we have. So, of course, there is a lot of scientific evidence that shows that mindfulness is helpful for many problems with mental health. But what we should be aware of is that I'm always saying mindfulness because that's the most studied approach in mental health settings. But of course, we can expand it to many forms of meditations, be them like mindfulness-based things, but also based on spiritual traditions. But the thing is that we should be aware of, for example, is that the practice of meditation, we should be aware not to do it all the time at any part. For example, someone who is highly suicidal, I will not advise that person to do some meditations at that moment, because he will look at all his suicide wishes and how bad he feels, might increase even his feeling of worthlessness, because and might increase the risk of going after the meditation to really commit suicide. So the advice is also to wait, is always to wait after an acute episode when the person is recovering, to then gently start doing meditations, or even if the person is really doing well and wants to prevent relapses, then learning how to meditate is really is really indicated. But during a dangerous phase, I would not recommend doing meditations. So there's a lot of evidence on what we call classically the neurotic problems, everything that has to do with anxiety, stress, depression. But what about psychosis? Usually mindfulness is not recommended for people with psychotic problems, because it is said it will increase the risk of psychosis. It's especially true for when the people are doing long meditations. And when I say long, I mean half an hour, 45 minutes. For many people, that's a long time. It's for them, if there is no feedback, we can say there is a risk of more sensory deprivation. And sensory deprivation will increase symptoms. So that's why, there have been experiments where they put people in sensory deprivation settings for a few days. So with no light, no sound, and no stimuli from the external environment. And everybody, even people with, most of the people with no history of mental illness, at one point, people start to hallucinate, start to have psychotic experiences. So after 3 days, most of the people are in a psychotic state, in a sensory deprivation setting. And so for people with psychotic illness, with schizophrenia or other illnesses where psychosis is involved, of course, if you they're more sensitive to sensory deprivation. So putting them on long meditation retreats or sessions will increase the sensory deprivation and might increase the psychotic symptoms. And so that's why we should be very aware. And I think it's a good thing to not allow those people into long retreats like Vipassana retreats or things like that, because it will trigger more psychotic problems. But does that mean that people with psychosis cannot meditate? I don't think so, because I meditate with my psychotic patients, because I have many, because that's my specialization, I have many people who suffer from psychotic illness. So what do I do with them? Well, I do short meditations, less than 10 minutes. And we see each other in group once a month, where we discuss together our experiences, so people can normalize also hearing what their experiences from one another are. And the idea is to try to do it every day for 10 minutes, not more than that. And what we do is very simple, just mindful breathing. And if people start to hear voices, because my patients hallucinate, even outside of meditations. So when they hear the voices, it's also like in mindfulness, is accept those voices without reacting to them, and just watching them like they're watching a movie, and accepting, well, even when you watch a movie can sometimes be stressful and sometimes can be very emotional, but it's just a movie. We know it's a movie. And so look at those voices and hear them without reacting immediately to them, because my patients are sometimes so afraid of their voices that they will adapt their behavior to not be annoyed by the voices. And so, of course, if it becomes too bad, I tell them you just stop the meditation and you go for a walk and you do something else. Then it's better to distract yourself with something else. So we shouldn't force things when it becomes too scary. So meditations which involve visualizations are also not very recommended for people with psychotic sensitivity, because it might increase their psychotic symptoms. And it's also important to reassure them very regularly, to say that things are going well, that they're doing fine, what they see is normal, what they hear is normal, and that they shouldn't be afraid, and that we are there to help them. And so the meditation for people with psychosis, the feedback I receive from my patients is also what I thought what was going to happen. It's not reducing their psychotic symptoms, they still have them, but at least it reduces the anxiety that goes with them, and it also teaches them to disconnect their behavior. So even though they hear voices that yell at them and are very scary, they will not, their behavior will not immediately react on that to reduce this fear. They will accept those voices more easily. So they're very happy to do those meditations. So to conclude, I want to say that in this modern world with increasing mental distress, slowing down can be very helpful for our mental health and to keep our mental health at a normal, good level. And meditation can be used as a cheap and accessible way to cope with mental distress. You don't need to go through expensive treatments for that. However, good professional guidance is necessary in certain cases. We should be aware of the risk and the dangers and find suitable meditations for specific patients. We should not give any meditation for anyone. And so in practice, I find that my patients who meditate regularly have started this for mental health, for improving their mental health, but now they are continuing this to use this as a more spiritual path. So it's like their mental health issues was actually the first step to a spiritual practice, and they have stopped seeing, well, I'm not saying all of them, but some of them have really, now they see this as their mental health issues as a first step to a spiritual path, and so as something not so negative as it was in the past for them. Thank you very much.
Thank you very much, Karanji. So specifically, scientifically, and clearly, simply also, you narrated that mental illness may be one of the biggest pandemic in the future, and how it is increasing in number at various parts of the world. And in many of the countries, we heard about gun or shootouts in the schools. This is also connected with mental health only. And you suggested meditation as a strong tool, but you also gave us some cautions to understand which kind of meditation suits to what need. And you also mentioned that how people with psychosis should not be given visualization meditation and other different things also you mentioned that were very important. You also mentioned about mindfulness based cognitive therapy. I'm sure that people who are watching this talk will certainly be benefited. United Consciousness looks forward to work with you in this field under your guidance for public good. Thank you. Thank you very much, Dr.
Thank
Karan.
you.
You're
Thank
so
you.
On behalf of United Consciousness, I thank Ms. Caroline Van Dem Hugh for coming onto the platform of United Consciousness. Thank you so much.